everybody. If you're watching me live, sorry for the delay. It was one of those where we had to do the re-sign in or whatever to Facebook, etc. Anyway, super excited for this conversation. It is born out of the fact that many practitioners have shared with me that you struggle to talk to your patients about your wanting to use or go additional and add on lab work, maybe not just once, maybe multiple times, but lab work beyond what another practitioner has recommended or has done in the past to get additional information. And so having that be a challenge, because oftentimes there's costs associated with these additional labs, we wanted to create a tool that made it very easy for you to show people, not tell them, show people why you're wanting to get additional information and show them the benefits. Additionally, in today's environment, it's really important that we help people understand that just having labs that they maybe have access to getting on their own, with direct-to-consumer lab purchases, may not be as helpful, definitely not as helpful as being able to have you go over labs and pull kind of all of the information together. And then even additionally, it's also really important for us to be able to go over labs from a metabolic health standpoint at different phases in our relationship with a client and being able to explain, or with a patient and being able to explain that. So let me come over and share our brand new tool. I'm super excited to go over it with you. I'm not going to go over what's on, there we go. Okay, so that part there. So this is the guide to metabolic health labs. I will be doing an Instagram live this Friday with Lara Zakaria, who helped me develop this, and she really did the lion's share of work, both as a pharmacist and as a CNS and functional medicine practitioner, and as a teacher. She teaches as a professor in a number of different clinical applications. She just found this was so necessary for the reasons I was just talking about, and did the lion's share of the work here. So I'm super grateful on that part. So a couple of things that are unique and valuable to you here. First of all, we actually give a different definition of metabolic health than what is often used, that looks more at metabolic syndrome, to help present the fact that you are going to be looking at more, that you really want to look at all aspects of metabolism and how your body gets and uses nutrients to produce energy and power its different functions. So in changing the definition, it also gives guidance to like what you are going to actually be doing. And then we go through how to use this. And so the way to use this is we've got two different parts. One's based on conditions, one's based on medications. And we invite somebody to review and look at what are the basic labs, the labs that are traditionally drawn, and then better labs, ones that may be included in addition to basic, and then what's our rationale. So for example, with thyroid, we know that just having the TSH doesn't give us enough information. It's not telling us how well T4 is converted, or these other pieces. And so we've got these others. Now, this doesn't mean that you may use all the better labs. It may mean that you recommend some of them. It also may mean that there are others that you want to include. This isn't meant to be the everything. It's basically meant to show them sort of that from good to better, or not good to better, which is often the case, especially in things like anemia, where we have, different types of anemia, and not just saying like, hey, it's just your iron. We know we want to dive deeper. We want to look at, if it's B12, we want to look at the different components there. For blood sugar, we want to help them understand that while fasting blood sugar may be helpful information, hemoglobin A1C, helpful information, possibly, triglycerides, helpful information, possibly, but we know the value of time and range in addition to fasting blood sugar, and really wanting to consider also looking at if we're able to get their fasting insulin on that piece as well. We also want to look at from a lipid panel standpoint. Sorry, somebody was asking. Yes, fasting insulin is included here, and I use that range at kind of all. I've seen the different practitioners using where something around like under 10, or some say between 2 and 8, some say below 6. So kind of in that range, and certainly if it's much lower, we want to see what's going on. Really diving much deeper into a lipid panel, not having somebody just look at their cholesterol, especially if their concern is heart health and risk of heart attack and heart disease, noting, and we share some information on that in terms of what actually what do we need to understand? And especially noting that 75% of heart attacks occur in individuals with normal cholesterol, often normalized through medication, statin use, et cetera. Some information about liver function, really diving deeper in where these are some labs that can be and are often done, but what else do we need to look at, really get good information about fatty liver, or inflammation or digestion, or, other things that are going on, some stuff around digestion. And then what we do is we also have them as it's listed as it's related to medication. So really understanding that when we are on certain medications, there are things that we want to be able to look at and maybe look at those consistently. If you're on a medication for longer than 6 months, should we revisit this to see that there aren't any issues in that space? We also included in here then the testing considerations. And remember, all of this is content that you can share in, of course, with the guide and put your logo on there and be able to use that. But things like social media, emails, you can also share this as a tool with the practitioner as a referral source for you. So they give it to their patient, and their patient then comes over to you and you run the labs, et cetera, on that part, or you interpret or you develop a plan based off of labs, depending on how you're collaborating with that referring physician or practitioner. And we go through, hey, let's not do them all at the beginning. We want that. Like, I love us as practitioners. We want all this data, but there's a right time, there's a right pocketbook budget, for that part, et cetera, on those pieces. And so we'll go through that. We do comment on should you do the labs on your own, and we explain like how that can really send you in the wrong direction on that space. Are labs alone enough? No, we have an entire toolkit for you in addition to this to help us. We know in addition to running iron labs, all those great labs to help us understand iron status, we need to know what you're eating. We need to know what's going on with you. We need to know what you're taking from a supplement standpoint. So there are, certainly things that we want to add to that. And then is your goal supposed to be normal? And we want to normalize that normal ranges are not normal, that we really want to look at ranges and understand how for individuals, how those ranges occur. And then we invite them to, based on the information, tee up a little bit for you what came out of this for them and what they'd like to work on and how they want to move it forward. So it really should drive more engagement with you on that part. So as always, just a wonderful tool in your toolkit. If you're somebody who has the tools, you actually have this one included in there. If you are somebody who does not have the toolkit yet, this may be that reason for you to go ahead at this time and grab the toolkit. And you will get this as well as coming up. We have an incredible thyroid evaluation. We have a really cool hydration tool. We've got a genomics, a nutrigenomics guide to help people understand how to use nutrigenomics and why you might be recommending it. And we also have other assessments around things like methylation and detoxification and some of those. So much more to come, obviously releasing a new tool every month. And if you have any questions, definitely sign up for a demo or just reach out to us. You can chat us on the website at thebetternutritionprogram.com. Excuse me, you can also ask any question here and we'd be happy to answer it. So as I said, super, super excited about this tool. I hope that you will check it out. Okay, take care. Bye.